Good afternoon, everyone, and welcome. My name is Kimberly Kuhlman, and I serve as the Executive Director of the National Spasmodic Dysphonia Association. Thank you for taking the time to join us today for this webinar. We know that daily life continues to be impacted by COVID-19. Many people are under a shelter-at-home order with only essential services being open, which means many healthcare providers are closed or appointments are being postponed and thus treatments delayed. That's why the NSDA has launched a series of webinars focusing on topics that are relevant to the current situation. We will also be hosting support sessions too via Zoom, and we hope you'll join us for those. More information can be found on the NSDA website, and we have also included links to that in the chat box, which you can see now. This webinar is being recorded, so if you can't stay the whole time or you'd like to view it later, it will be available on our website under the webinar page from where you registered. And also, Christy did put together two handouts, wonderful handouts. The links are in the chat box, but they can also be found on the website under the program name. Today's discussion is part one of two around voice techniques to manage symptoms of spasmodic dysphonia and related conditions today. Our speaker is Christy DeLuca. Christy is a speech-language pathologist who specializes in the assessment, treatment, and research of spasmodic dysphonia. She currently works as a clinical voice specialist at the voice program at Brigham and Women's Hospital in Boston. She has lectured for graduate and medical students, has provided hospital in-service presentations on voice treatment, and has presented her research at conferences for both the NSDA and also the past 6 years at the American Speech, Language, and Hearing Association conferences. Christy also has spasmodic dysphonia, and which gives her a unique insight into the disorder as a patient, researcher, and clinician. Christy, welcome.
Thank you. So hi everybody, I am Christy DeLuca. So like Kim said, I am a voice therapist. So I work with patients with voice disorders across the board, but I have a unique insight into spasmodic dysphonia and neurological voice conditions, as again, I do have spasmodic dysphonia myself. So, I know right now is an extremely difficult and challenging time for many people for a number of reasons, but having a chronic voice condition can make that all the more challenging. So, I know that many individuals have had Botox injections that have been rescheduled or canceled to where they might not know the date that they're going to be rescheduled. That can cause many individuals to have much more severe symptoms if they are relying on their Botox injections to kind of manage their symptoms. I know that everybody in general right now is dealing with a lot more anxiety and stress in general, and that can certainly, as many of you probably recognize, can lead to increased voice symptoms, and it can lead to more tension or strain when you're trying to speak. And, I know a lot of you are also talking on the Facebook page too about increased demands on the phone, increased demands virtually, so Zoom meetings, phone calls, even to stay in touch with people and to connect with people. It's all virtual right now, or it's all phone calls right now. And for somebody with spasmodic dysphonia or somebody with a, neurological voice condition or, a chronic voice condition, those can all make symptoms a lot worse. So I'm going to run through some voice therapy techniques today. So, I do want to start with a few caveats. I will say that, voice therapy generally, it's recommended that you do it with a speech-language pathologist and voice therapist. And that's important to note because you want to make sure that you're doing strategies in the correct way. You want to make sure that you're doing strategies that are really going to be helpful for your specific symptoms and your specific needs. So I'm going to give a very general overview of voice therapy techniques that could be helpful. But again, it's very general, and each person should really find a speech pathologist to work with on these techniques. If they're wanting to get more into voice therapy. So the other, and I will say that right now that does look like teletherapy. So, you know, if you're looking to work with a voice therapist, it's going to be teletherapy at this point. So the NSDA has a great listing on their website for providers that do teletherapy and speech language pathologists that are doing teletherapy right now. If you're looking to receive those services, I think that's a great place to start. You do want to make sure that the provider is licensed in the state that you're currently in, as well as their state. So, you know, I'm licensed in Massachusetts, but also in several other states. So I would be able to see patients in the states that I'm licensed in, but not any other state. So you want to make sure that the provider should be knowledgeable about those restrictions, and some of them are loosening their, some states are loosening their regulations, but you do want to make sure and keep that in mind if you're looking for a provider. So, you know, the last caveat here is that if you have spasmodic dysphonia or you have vocal tremor, these techniques are really not meant to cure the spasmodic dysphonia or the tremor. The techniques can resolve something like muscle tension dysphonia if it's not secondary to something else like spasmodic dysphonia. So these techniques are really designed to be compensatory, which means they'll give you a lot of helpful tools and strategies to be able to really control your voice and to be able to maybe not have a perfect voice quality. You're still going to have the underlying symptoms of tremor or spasmodic dysphonia, but hopefully these techniques can give you some tools to better manage those. So I encourage you to try these techniques along with me. I'll kind of walk you through what you should be feeling and maybe what to look out for to avoid feeling while you're doing these. So I can't see any of you, I can't hear any of you, and nobody can hear you or see you. So if you want to practice these voice techniques, go ahead. I fully encourage you to practice them along with me. So we're going to start with some resonant voice techniques. These techniques are really meant to re-coordinate how you're using your voice. So all these techniques I'm showing you today are really to re-coordinate how you're using your voice, to hopefully get you to be using your voice in a more efficient way. So again, they're not curative. You're still going to have the underlying symptoms if you have a neurological voice disorder, but hopefully it can give you some relief of the strain maybe that you're feeling, or the tension or vocal fatigue that you might be feeling. It can hopefully give you some techniques to, you know, be able to speak on the phone more easily, or to be able to communicate via Zoom meetings, or to be able to better manage your voice. So I'll start with resonant voice techniques. So the idea here is to get a really forward focus of your voice. So, you know, I can use a voice that's really focused in my throat. And, you know, if I'm, you know, saying a sentence and drop it down into my throat, you hear that's a very rough voice. I feel that a lot in my throat, and I can feel roughness, I feel vibration here, and I feel tension in my throat. I can shift my voice more forward, which is what I'm trying to do a little bit more of now, and shifting it to where I'm feeling vibration more forward at my lips, in my nose, in this kind of mask area, rather than kind of letting my voice sink down to just be in my throat. So we'll start with what's called a resonant hum. This is a basic resonant technique. So you can try this along with me. You want to really do this in a normal volume and a normal pitch for yourself. So don't try to go way up in pitch. Try to do it at a normal volume, normal pitch. So you're trying to get, so I will say also Zoom may try to modify the sound a little bit. It may dampen the sound a little bit after a few seconds, but you should feel strong vibration. You should feel a consistent vibration, a consistent pitch and consistent loudness throughout this whole thing. Okay, so I'm feeling a lot of vibration here. If you have tremor, you're still going to hear a little bit of that tremor. You want to not try to fight against that. If you have tremor, let the tremor happen. If you're trying to fight against that, you're going to likely be using a lot more strain and tension, and that's what we're trying to avoid. So try to get a really easy production, something that just feels really effortless. You don't want to be feeling anything really at all in your throat here. So if I'm doing hum and it's something like this, or right? I'm feeling a lot in my throat there, and that's really what we're trying to avoid. So doing a hum where you feel more forward focus is really what you want. So, okay, so trying to get a lot of vibration forward. I feel a lot in my lips there. If you're having difficulty feeling that at your lips, you might still be focused a little bit in your throat with that sound. So you want to try to think about the vibrations growing here at your lips. So try to focus and get your voice to be shifted forward a little bit. So again, really strong vibration with no effort here. You're not pushing to try to make that sound. If I'm squeezing my muscles in my throat to make that sound, it would sound very strained, right? That's not what we want. We want an easy production where these muscles are pretty relaxed. And you try to feel a lot of that strong buzz in the front, okay? So if that's still difficult, you can try to do a sigh hum. Okay, so again, you're trying to get all the vibration to be really focused forward when you're doing that. So that can help you. The sigh hum can help to release some of your airflow. Make sure you're not holding your breath when you're doing this. So some of you might try to compensate for some of your spasmodic dysphonia symptoms or vocal tremor, for instance, by squeezing these muscles in your throat. And you might try to compensate like this, right? So this resonant voice technique is trying to get rid of all that strain and trying to give you an easier production, a more efficient voice production here. So you want to make sure that you're not holding anything, you're not squeezing your throat, you're trying to really release all that. Okay. If the hum is not feeling great, you can try to do this with other resonant voice sounds. So you can try maybe using an N sound. So hold out that N. You're going to feel this more at the roof of your mouth, maybe at the tip of your tongue when you do this, than directly at your lips. Okay, so you might feel some in your nose, you might feel some at the roof of your mouth. Again, the object is to feel that strong vibration coming forward. So you can try a V sound, which is really, you're going to feel that at the tip of your lips. So again, sustained sound. Feel that strongly at my lips. Nothing in my throat. So if you're pushing, right, you're going to feel a lot of strain in your throat, and that's what we're trying to get away from. Again, this should feel really fluid and easy. Your breath flow should feel pretty released with this. So you can try the hum, or a regular hum, or you can try an N sound, or a V. Okay, so again, I'm feeling a lot of feedback here, and I'm not feeling anything in my throat here. If you're feeling like it starts here and then goes down to your throat, you want to make sure that you're maintaining consistent vibration and airflow. So if it starts off here and then it goes rough, it'll sound like this, right? Then I start to get some of that, those breaks, that tension in my throat. You want to try to keep it consistent. Okay. Once those are feeling good, you can try to bring that into a resonant voice chant. So you can try to chant that with some resonant voice syllables. So you can do something like me, me, me. Okay, so you're trying to feel that vibration consistently at your lips here. Me, me, me. Okay, you can try that with a mo, mo, mo. Again, the object here is not to get a perfect voice quality. So if you have an underlying voice condition, especially if it's neurological, like tremor or spasmodic dysphonia, you'll likely still hear some of those symptoms, but you're just trying to smooth out that voice a little bit. And again, you should not be feeling anything in your throat when you do this. You can try to do a chant with some of the other sounds that you've worked on. So maybe the N sound. So you can do no, no, no. Okay, again, I'm keeping that resonance throughout the whole thing. I'm not feeling the squeeze. No, 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 right? It's not squeezed in my throat. I feel that a lot. You can hear that strain in my voice. We're keeping it here, keeping it easy and released. You can try using some increased intonation with that. So you can do something like me, me, okay? Me. So again, that's not sounding much like natural speech, but you're exaggerating that intonation pattern a little bit to get it out of your throat, to try to increase your airflow a little bit and to get a more efficient pattern. You can try to bring that into sentences. So if I do a sentence with a lot of those resonant sounds, like maybe a sentence with a lot of those M's or a lot of those N's, we can choose a sentence like meet me at noon. So I'll do meet me at noon. So I'm trying to keep my voice really focused here rather than using so much strain and effort in my throat. So if you're compensating for spasmodic dysphonia or tremor, or you have MTD, you might be tempted to engage these muscles and it might sound like meet me at noon, right? That's a lot of strain in my throat. If I'm shifting my voice forward and trying to let my breath flow forward with that and feel that consistent forward vibration, I can get a smoother voice quality. So again, meet me at noon. Okay, so I'm trying to get that really, really forward focus. Again, you can play around with using some of that kind of bouncier voice quality. So a little bit more of that intonation when you're speaking. So meet me at noon. You can try this with other sentences. So you can try this with something like nice to meet you. So nice to meet you. You're trying to get that forward focus. You can try it chanted first again. Nice to meet you. I'm trying to get that forward focus of the vibration. You can make sure that you want to make sure that it feels really easy. Okay, so this should not feel like work. It's not designed to work your vocal folds. It's not designed to work your muscles in any way. These are not strengthening exercises. That's not the goal. The goal is to just get a little bit more of an efficient voice quality. So that's one technique that you can use resonant voice techniques as kind of a voice warm-up. So, you know, for instance, I might use some resonant voice techniques to warm up my voice in the morning. So I'll do some hums, some maybe resonant voice sounds, maybe some sentences, and you can really feel your voice be more focused here rather than be so much rather than being focused in your throat. You can use the resonant voice strategies as kind of like reset techniques. So for instance, if you're having a lot of Zoom meetings, or if you're having a lot of phone calls, or even if you're talking a lot throughout the day, you can use these resonant voice strategies to reset. So do a few hums in between your Zoom meetings, or do a few hums, you know, before you get on the phone with somebody so that you feel like you're a little bit more in control of your voice. You have a little bit more expectation about what's going to come out when you open your mouth, right? You know, that's something for spasmodic dysphonia where sometimes you don't necessarily know what sound is going to come out. It could be unpredictable. And so these strategies can give you a little bit more control over those voice symptoms. Again, you're not trying to fight through breaks here. You're trying to ease maybe through the breaks with a different focus of your voice, increased efficient breath use, and a more efficient pattern of voicing. So the goal is also to start to use these strategies for when you're speaking conversationally. So instead of kind of like speaking with a lot of effort here in my throat, right? So you might be tempted to compensate in that way in your throat. I'm going to try to use these resonant voice strategies when I'm speaking to have less of that throat impact, less of that strain and that muscle tension. So that does take some practice to start to feel what that feels like. It does take practice of doing some of these resonant hums, these resonant sentences, and using these strategies, you know, in conversation. it does take practice and repetition of this to really be able to start to use these strategies in conversation. But that's the end goal, to be able to implement them in any conversation that you're having, whether it's a phone call, whether it's an in-person conversation, whether you have a more challenging voice day or a voice or a day with worse voice symptoms, you might be able to rely on these voice strategies a little bit more. So, you can rely on them more so too when you're having a harder voice day, or when you're having increased voice challenges like right now. So I'm relying on voice strategies more so than I would, for instance, when I'm, at my optimal Botox injection cycle. So it's okay to do them throughout the day. It is also going to be beneficial. So you can do them as often as you'd like to, as long as they're being done in the correct way and that they're feeling easy. And again, the best way to know that is by working with a speech language pathologist and voice therapist directly while doing this, to make sure that you're doing it correctly and working towards your goals and specific needs. But you can try out these voice strategies. I know right now is a very challenging time where not everybody has access to care. So as long as they're feeling easy and they're feeling good, you can start to explore some of these techniques and how they can be helpful. I will show you another technique. And again, I'm going through these very quickly. This is a very, very brief overview of some techniques, but they're just a brief window into how voice therapy can be really beneficial for managing and coping with some worsening symptoms. So I'm going to show you something called straw phonation. So it is called a semi-occluded vocal tract technique. So basically, it's a really ideal and optimal configuration of your vocal tract that gives you an optimal voice efficiency. So it gives you optimal voice outputs, so a clear, efficient, smooth voice with very little effort in your throat. So one strategy for this is straw phonation. So I know most of you probably don't have straws just lying around. If you do have a straw somewhere, wherever you are, and you want to try this, you can try this along with me. So basically, we're going to take the straw and put it in your, between your lips, to put it in your mouth, and your lips should close around the straw. So you're not going to use any tension here. You're just going to place it gently in between your lips and try to get the same feeling as when you're doing the hum. So it's going to feel a little bit different here, but you should feel the same amount of vibration. You should feel the same amount of resonant feedback here when you're doing this. So you can, again, try this with the straw in between your lips. Okay, so I'm feeling a lot of feedback here. I'm not feeling effort in my throat here. The sound is moving through the straw when I have that strong vibration here. I'm not pushing anything through the straw. I'm not working harder to get the sound through the straw. If I have a strong sense of vibration here, it will go through the straw without me having to push, okay? This is designed to make it a little bit easier to voice, to get sound without using so much effort in your throat. So again, you can try that hum with the straw in your mouth. Should almost feel like you're like playing a kazoo. A kazoo is also really helpful for something. You can use a kazoo kind of in a similar fashion if you do have a kazoo. It's getting at the same aspect where you're using your airflow efficiently. Your vocal tract is in a really efficient configuration, and it should be really easy to do, okay? So this is a great reset technique too. It's great to train a more efficient voice production pattern. So if you're having trouble getting any sound here, think about what we talked about with the hum, maybe releasing some more of your airflow or checking to make sure you're not squeezing these muscles here or holding your breath. So you can try the side hum through here too. Okay, a good check is to see if there's airflow coming out on the other end of the straw. So I feel consistent airflow coming through. Again, I'm not pushing that airflow out, but because I have that strong, consistent vibration, I feel that airflow coming on the other side. You can try this in water too. This is one of my favorite techniques. Again, this might not work for everybody, and this might take a little practice to coordinate for you, but you can try this in a glass of water too. So I will warn you, don't use a full glass of water because this will get everywhere. So just a glass of water filled partly or halfway through, halfway up. You're going to take the straw and do the same exact thing that you just did. Now just with the straw a little bit under the water. So you can start with it just about an inch under the water. Okay, so you see that I have some bubbles forming here. They're consistent, they're even. I'm feeling that consistent and even feedback on my lips with that. So again, it's getting that really even, easy voice where you're not pushing any of that. Don't work harder just because you have water here. Try to just keep it about an inch to start under the water. You know, this can be really helpful in releasing some excess tension and again, creating a more efficient voice production pattern for you. I use it as a reset technique too. So if I'm having a lot of phone calls and I have a quick minute in between patients that I'm seeing or in between phone calls, I'll just do a little bit of, for me, that feels really good. And it gets my voice back to a place that feels much more efficient and more forward and easier. You might notice that after you do that for a few minutes, then maybe your voice is a little bit more released. Maybe it feels a little bit easier to speak after that. So that's the goal, that you also kind of carry this feeling into how you're speaking. So how you're conversing after this, you should be able to maybe feel a little bit of a release of the strain or feel that that gives you a little bit more of this forward focus that we're going for. So again, you can do this as often as you'd like. You can do this, you know, about 10 minutes per day or as a warm up in the morning or as resets, as long as you know that you're doing it correctly without effort in your throat, without that push, without that strain. Okay, so, you know, I know we're running short on time, and again, I went through these really quickly. There is a handout that goes along with this that goes over teletherapy, and then there's a separate one that kind of goes over the techniques that I talked about today. Again, remember that these are not meant to get you to a perfect voice quality. They are meant to give you tools to cope. You know, my voice quality is not perfect, and anybody with SD or tremor, you're going to still have those symptoms, but you can hopefully manage them a little bit more efficiently with these strategies. So I'll go quickly through some helpful tips. I'll go into this in a little bit more detail in the following webinar, but for phones and virtual visits, headphones are going to be a really great tool. So I have an iPhone, so I use Apple headphones, and these actually have a built-in microphone right here. So if you have the headphone in, you can actually speak directly right into the microphone here, which is really helpful. And it's much more helpful than trying to speak on the phone where your voice is not directed exactly into the microphone. That's a helpful tool. If you put your phone on speaker, that can also be helpful. So putting it on speakerphone and then holding the phone right in front of you can be much more helpful than if you're holding the phone up to your ear again and trying to speak that way. Use all these techniques that we talked about before a phone call, before a virtual call. Warm up your voice and maybe practice your hello, right, in this forward focus. Maybe practice what you're going to say on the phone call in your resonant voice, and that could be really helpful too. You can also try to speak more forward. Most people tend to project more by using effort in their throat, especially on the phone. You think that people aren't going to be able to hear you as well, and sometimes you do need to project a little bit more. Try not to do that from more effort in your throat like that. Try to do that by actually releasing these muscles and using those techniques that we talked about today and making those sounds a little bit more resonant, and shifting your focus a little bit more forward, getting those sounds to be a little bit crisper or clearer at your lips. And so I also use a technique sometimes of having one headphone in. You know, this is what I use for computer webinars. It can sometimes be helpful for modulating your volume. So if I were to have two headphones in right now, it's a lot harder for me to gauge my volume versus if I only leave one in, I can kind of get some more feedback as to what volume I'm speaking at and how my voice is functioning. So that's an added trick that you can play around with. Again, warm up your voice or use these techniques even right before a phone call. So do some resonant voice work, do some straw phonation, and you'll feel like you have some more control right before you go into the conversation or the phone call. All right, so again, you can write in this chat box if you have any specific questions. I'm happy to answer them. If you guys have specific questions, feel free to write them in the chat box here. You can also email me. So my email's on the handouts that we're going to be posting. They should actually be posted here if you guys can see the links here, as well as where the webinars are. So check out the handouts for kind of listed out instructions of what I'm telling you now. You can also email me. So my email is my first name, Christie. So it's CHRISTIE J Deluca, DELUCA, and that's at gmail.com. So you can feel free to email me if you're having trouble finding a provider in your area, if you have specific questions that I didn't cover, if you want me to cover specific things in the part 2 of the webinar. I'm also happy to, take suggestions too and try to kind of modify that to be specific to what your needs are or what your specific symptoms are. So hopefully this was helpful in some aspect. Again, it's an extremely, extremely basic overview of some techniques, and I went through them very, very quickly. So don't, expect your voice to be perfect after just trying these for a few minutes. It does take practice. It does take exploring your voice. So hopefully this can at least be a start. And yeah, so I hope you guys join me for the next one as well, which will be in 2 weeks.
And Christy, we do have a question.
Sure.
The question is, I often run out of breath before I finish a sentence. Any techniques for sustaining my breath?
Yeah, so I'm actually going to do some more efficient breath use next time. So there's something called flow phonation, which might be really helpful for you. It sounds like you're probably using a lot of tension or push. So if I'm, kind of working harder to get my voice out, I'm going to run out of breath a lot more quickly than if I'm trying to release some of that and use a consistent airflow when I'm speaking. Using this resonance, using this forward focus will also help you to be able to modulate your breath a little bit more efficiently. So I would focus on trying to decrease any sort of effort or push that you have in your throat right now, changing the focus to be a little bit more resonant up front, and thinking about your airflow being consistent when you're speaking. So instead of pushing a lot where you're going to run out of breath pretty quickly, you're going to try to modulate that and think about your breath flow being a little bit more consistent and even. Again, I'll go through that a little bit more in detail next time with the techniques I'll go over in round 2, but for now, those are some things that can help.
Wonderful. Well, Christy, we really thank you and appreciate you joining us today for such a helpful webinar. And I hope all of you will join us on April 23rd when we continue this conversation. Next Thursday is actually April 16th, which is World Voice Day, where we celebrate our voice. And NSDA will be doing some programming around that. And there are other webinars available that can all be found on the NSDA website. And if you go, we will have this webinar, recorded version of this webinar posted probably by tomorrow. And if you go to the page with the NSDA webinars, scroll down to this one, and if you look at it, you'll find the links for this, for the webinar, and also for the handouts. In addition, there was a question too about finding healthcare providers that do telepractice. In response to this, we actually, NSDA, emailed our healthcare providers and asked them to update their listings, and we have gotten a response from that. We can also pull together a list so that the people who have responded, we can have that list in one place. So we will work on getting that together for you also. Again, thank you for joining us. This has been wonderful, and we look forward to seeing everyone again at the next webinar.
Thank you.
Thanks. Bye-bye.
Bye.